Hi, everybody. Thank you so much for coming. We are beyond excited to have this opportunity to learn from and unlearn with the trans and non-binary experts of color. Thank you so much for coming, and thank you so much, San Diego Psychological Association, for having this event. And if anybody is not a member, please join us. Join us in the movements to make the world kinder and better and welcoming space for everybody of all diversities. So without further ado, please introduce wonderful speakers.
Sure. Hello, everybody. I'm Joe Severino, pronouns he, him, and I am the member at large for diversity for the SDPA, serving on the board. And I am so pleased and honored to present Dr. M. Matsuno, they, them pronouns. And Dr. Matsuno is an assistant professor in counseling psychology at Arizona State University, and their research interests focus on trans and non-binary minority stress and resilience using both qualitative and quantitative methods. And their goal is to develop and test interventions that decrease negative mental health outcomes and increase well-being among trans and non-binary people. And I want to say that Dr. Matsuno is the principal investigator on four studies that are running right now, it looks like, looking at various aspects of trans resilience and increasing well-being. And among their many accomplishments, Dr. Matsuno served as a member of the APA task force, which was responsible for revising the professional guidelines for the psychological practice with transgender and non-conforming people. And if you don't have that, I would highly recommend that you go on to the APA website and download yourself a copy. And they've also served as the program chair for APA Division 44, as well as serving on the editorial board as an editorial board member of the Journal of Psychology of Sexual Orientation and Gender Diversity. So we're so pleased to have Dr. Matsuno join us. Thank you.
Yay, thank you so much for the introduction. So let me share my screen here.
And actually, before we get started, I think we'd like to just give quick introductions to the other two speakers that'll be jumping in on the panel afterwards.
Sorry about that, yeah, please do.
Yeah, okay, cool.
No worries. Hi, everyone. My name is Sabrina, pronouns she, her, hers. I am the graduate student representative for the San Diego Psychological Association, and I am honored to introduce Kiona Dalen, who will be one of our panelists today. Kiona is an artist, educator, advocate, and activist here in San Diego, and they have been working in advocacy and activism for the last 16 years through a variety of organizations, including Planned Parenthood, Wingspan, the San Diego LGBT Center, and a grassroots community space in Tucson and Philadelphia. Kiona has also worked in nonprofit and religious institutions and roles that have focused on racial justice, equity, and inclusion. Kiona's lived experience as a queer Black individual, years of training in nonviolent communication and restorative practices, and advocacy for queer and trans youth in schools, foster care, and youth shelters, all inform their approach to creating safer spaces through the centering of historically excluded individuals. She works primarily as a freelance educator and consultant to allow room for their artistic endeavors as a dancer, choreographer, and circus performer. Kiona currently lives here in San Diego with their wife and their child.
Hi, everybody. Happy to be here. Go ahead and just.
Hi, everyone. My name is Corinne Lippert, she, her, hers pronouns. I am also a graduate student member on the LGBTQ+ committee. I want to thank everyone for coming today, and I am honored to present the wonderful Matthew Meritori. He, his, him pronouns. He was born in Sofia, Bulgaria, and raised in Tennessee after moving to the United States as a young child. And then in 2014, he graduated high school and went through multiple training schools, receiving several certifications and learning about health for the body, mind, and the soul. On June 8th, 2018, Matthew came out as transgender while he was living in an all-girls sober living. Matthew is currently attending courses at the University of Phoenix, earning a Bachelor of Science in Applied Psychology. His long-term goal is to attain his PhD in clinical psychology and to work with transgender people who are also needing guidance and announcement during their time of transition. Thank you so much.
Thank you so much for that introduction. I'm excited to be here and I can't wait to dive into learning so much more as well. So Here we go.
Thank you so much, everyone, for being here. I'm Katrin Seifert. I am a member of the SDPA LGBTQ+ committee, and I'm going to be sort of monitoring the incoming questions today. So please submit your questions through the Q&A as opposed to the chat. And you can submit two different types of questions. One would be like for the presenter, for Dr. Matsuno, about the presentation, and then the others would be, we're going to have the panelists speak after the presentation. And so if you have questions that arise that you hope the panelists might answer, please submit those during the first half so that we can collate them and make, decide how to present them to the panelists in the second half. And maybe you can just specify in the Q&A like for the panel. And so I am so happy to turn this over to Dr. Matsuno. Thank you so much.
Thanks, everybody. I got overly excited about getting started. But thank you so much for inviting me. It's a true honor to be here. Thank you all for being here on a Saturday morning. All right, so let's try this again. Let me share my screen. Okay. Wonderful. Okay, so as was mentioned, my name is Matsuno, they, them pronouns. Just finished my first year as an assistant professor in the counseling psych program at ASU, so I'm very excited to be done. And I also want to acknowledge I live in Tempe, which resides on stolen land from the Odom and Pipash peoples. And before I get started today, I think it's just really important for me to talk about my positionality and name my positionality, because that really impacts how I come to this work, the experiences that I've had. I will try to talk about some of my lived experiences in the presentation, but also recognizing that I have a lot of privileges and different experiences from other trans and non-binary people of color. And so I'll just start by naming that I identify as trans, as non-binary, as queer. Those are three, very salient identities to me because they really impact my day-to-day life. But I also recognize that even though I am trans and I'm non-binary, as a trans masculine person, I do hold a lot of privilege that other trans feminine people in our community do not have. And then I also identify as a person of color. I am multiracial. So my mom is white and my dad is Japanese. He's an immigrant from Japan. And so while I identify as a person of color, I also recognize that I have a lot of light skin privilege. And so because of colorism, I'm going to have a lot different experience compared to other Black and brown people. And then finally, just wanted to name a few other privileges that I have, holding a PhD, lots of educational privilege, socioeconomic privilege, and as somebody that doesn't have a disability, those limit my experiences and perspectives in those areas. So I just wanted to kind of ground myself and where I'm coming from in my positionality before we get started. Okay. So I'm going to try to cover a lot of ground in a very short amount of time. And so as was mentioned, if you want to put your questions in the Q&A, hopefully I can answer those maybe at the later portion in the second half of today. So what I'll be talking about today is intersectionality and why that matters. So we'll do a quick introduction into that concept. And then we'll see how this applies to trans and non-binary people of color. I think it's really important to understand history and the role of colonization. So that's going to be the second portion. And then the main bulk of what I'll be talking about today is some of my research, a lot of research on minority stress and resilience and resistance. So just so you know what to expect. Okay, so let's dive in. So intersectionality is a term that I'm sure many of you have heard before, but what does it really mean? And I want to make sure that we kind of go over this so that we're all on the same page. And so intersectionality stems from, Black women and Black feminist thought. And so Kimberly Crenshaw was the first to use this term in the late 80s. But just want to also not acknowledge that a lot of the writing and a lot of the work in this area comes from Black women. And so Kimberly Crenshaw in this quote talks about intersectionality. It's a lens through which we can see where power comes and collides, where it locks and intersects. And it's the acknowledgement that everyone has their own unique experiences of discrimination and privilege. I think that maybe one common misunderstanding about intersectionality is that, oh, we just all have different identities, so we're all kind of different. But really, it's talking about how systems of power and privilege and systems of oppression intersect and then actually create unique experiences for individuals at those intersections. So it's not purely an additive process, right? So for trans people of color, they're going to experience oppression and stigma based on their gender. They'll also experience oppression based on racism and their race. And they're going to experience unique forms of stigma and stress, like racialized genderism, right? So this intersection and overlap. And if you look at this photograph here, you'll see that because of all the overlap, it actually changes the color. So it changes the experience. It's not just the adding of different marginalizations, it's also the combination. So I think that's really important to think about and understand. I also want to name so intersectionality, a lot of it came out of, women's rights. And so when we think about different communities and different rights, and we only focus on one axis of oppression, what inevitably ends up happening if we don't have that intersectional perspective is that the people within that community who have the most privilege, who have the most dominant identities, their issues and their voices are going to be centered. So if we think about, the women's movements, right, and this is where intersectionality came about, is that really the women's rights movements were centering the needs and issues most related to white, cisgender, heterosexual women. And we see the same thing happening within trans communities or within people of color, right? It's like those with other privileged identities come to the forefront, and who gets left behind, who gets excluded and overlooked? Those with the most marginalized identities. And so that's just something, we tend to just generalize like, oh, the trans community, but without recognizing how different experiences are going to be based on those other intersections of oppression. And so that's kind of really where I'm coming from and why this is so important. So I know that was brief, it could probably go on for longer. But next I want to go right into history and the role of colonization. I think history is so important to understand the context and how we got to where we are today. And so actually, before we get into this, I wanted to show a video clip. I was having a little bit of difficulty with getting the video to work, but I think the audio is still actually really helpful. So I'm going to try to just share. Maybe the video will work, but if not, we'll just listen to the audio. So what I wanted to share comes from an episode on Netflix, so I highly recommend that you watch it. It's from the show with Jonathan Van Ness. They have a new show called Getting Curious, which is kind of based off their podcast. And they have an episode called, I think, Bye Bye to the Binary. And it's really good. It has a lot of my favorite activists, including Alok, who will be speaking here. So I'm just going to share this. Let's see if we can get it to work. Yeah, so I recognize you might not be able to, it'll just be audio, so just bear with this.
How do you feel when you're here in this place? I feel a remarkable sense of pride and resilience because a lot of people don't understand that it was like gender non-conforming people that made this happen. And then a lot of sadness because people don't understand it was gender non-conforming people that made this happen.
Alok is a speaker, performer, writer, activist, non-binary bad bitch. I wouldn't be the person that I am without Alok's friendship.
And to be able to share this space on these streets where so much history has taken place is something that is not lost on me.
To the Marsha P. Johnsons and the Sylvia Riveras who have come before us, we wouldn't be here without you.
What most frustrates you about the way that the gender binary manifests itself?
I think it would start that us existing in public gets made into a problem. That people think that this is not just a normal Friday afternoon. They're like, why do you look like that? That we live in a world where it's still so unsafe and so scrutinized and made such a spectacular incident to do something as simple as exist. In New York City, from 1845 on, it used to be illegal to do exactly what we're doing right now. there was a masquerade law that was put into place that made it a criminal offense to wear the clothes of the opposite sex. So people used to literally build relationships with different bars where they would hide their heels. People used to have rags in their back pocket that they would wipe off their makeup before the police came in. And so the reason that people still have so much scrutiny of us is just because for so long, they've tried their best to disappear us.
So when we say they have been trying to disappear us, is that government, like city government, state government?
Yes, I'm saying there's been an orchestrated attempt to literally eradicate us. They make it about specific policies, about minutia, but the organizing frame is always, we don't want trans and non-binary people to exist, period. And so what happens right now is people will exceptionalize us and say, well, you're so brave, you're so resilient, but why should it have to require bravery to do something as simple as walking down the street?
Right.
Why should it require bravery to actually live life on your own terms? We exist, and that's not political, it's factual. We exist, and that's natural. What is political is making people fit into boxes that were predetermined hundreds of years ago.
Yes, we have existed for thousands of years prior in all sorts of different cultures.
Right.
And the politicization and criminalization of gender expression is really what is new.
Right.
What is it about non-binary and trans people that is so threatening to these systems of power?
We represent possibility. We represent choice. Being able to create a life, a way of living, a way of loving, a way of looking that's outside of what we've been told that you should be.
Honey, arriving at Stonewall on that note, I love you so much.
Thank you.
All right. So apologize for not being able to see the visuals, but I really encourage you to go back and watch that episode. Alok is just one of my inspirations, and they're an amazing activist and poet. And so highly recommend looking them up, following their social media, buying their books. So I wanted to show this as kind of an introduction to thinking about the history of gender. And so, as was mentioned, oftentimes we think that trans and non-binary people, this is like a new fad, this is a new thing. But really, we've existed throughout history and across all cultures, right? And so just to give some examples, many indigenous cultures across the globe have, genders outside of the gender binary. So oftentimes we think that, the gender binary, this is what's always been here. This is just what's natural, and then that trans people are new and different, right? But actually, if we go back in history, most indigenous cultures, most cultures didn't conceptualize gender in a binary way. They understood gender as, maybe 3 genders, 4 genders or more. And people that were outside of that gender binary were not stigmatized. They were not looked down upon. They actually had a very sometimes sacred role in the community and respected role in their community. So what's new is this enforcement of the gender binary, right, and essentialism. And so, how did things shift from, if we go way back in history, a lot of gender diversity has been really accepted and embraced. And so how did we get to today? And this is where the role of colonization comes in. And so one thing I think is really important to know is that the gender binary as a categorization system, the gender roles of what's for men and what's for women, that's really stems from European, white, Western, Christian culture. And so that system, the gender binary through colonization, is what has spread this idea of the gender binary across the globe. And it's really erased the history and the acceptance of gender diverse people. And so this history, I think a lot of people don't realize this history, don't know this history, including people who are trans, non-binary, two-spirit, right? And so without knowing that, or learning about this history, that actually, if we go back to our ancestors, our roots, we have so much power, we had so much respect, we were considered wise and sacred. And so I think learning about that history is important for all of us, but also can be really empowering and healing among trans and non-binary people. So I'm not going to be able to go into, a lot of detail about this concept, but I I read this book actually last fall, Decolonizing Transgender 101, and it really changed my life. I thought I knew a lot about trans and gender, but I really recognized like, wow, a lot of the dominant narratives, a lot of what we're taught, even in our Gender 101, comes from a very white lens. And so this book just is amazing. So I highly recommend it. So I put it in here for reference. Okay. So another point in history that I really want to talk about is our history within psychology and as a field. So we have a long history of pathologizing trans and non-binary people, of gatekeeping access to gender affirming care. And so it's important that we actually know this history so that we can acknowledge it and work through that. But surprisingly, a lot of people don't actually know, right? So for example, transsexualism being in the DSM, then gender identity disorder, it continues today with gender dysphoria continuing to be in the DSM, which gives a lot of people, they'll use that to say that being trans means that you're mentally ill or it's a mental illness. I want to talk a little bit about gatekeeping. So in the 1950s, this is when gender affirming surgeries first came about as being accessible. And so after this point came the creation of WPATH, which is the World Professional Association of Transgender Health. Now, Harry Benjamin is the founder, who's the author of this book here, the founder of WPATH. And just to understand that WPATH, most of the members were psychiatrists who were white, cisgender, heterosexual men. So WPATH, their role is really creating guidelines for doing assessments, clinical assessments to see whether somebody is able to have access to gender affirming surgery or gender affirming hormones. So in the 1960s, 1970s, there was these different gender identity clinics where clinicians would work and do very lengthy assessments. And their goal in their assessment was to determine whether somebody was a quote unquote true transsexual, right? So you have to really prove your identity. You really have to meet this certain expectation for what it means to be a quote unquote true transsexual. And these assessments would sometimes take years, right? And so think about the money, that's a barrier. Think about just how invalidating an experience is when you know that what you need to feel good and the medical care that you need, but you have to go through a mental health evaluation. Also, this gatekeeping system, it's different, but it continues today. And so just looking back at some of the old criteria, I think is also important. So at this time, some of the requirements for the assessment that people would assess trans clients on, they had to consistently identify as their desired gender from early childhood, never change whatsoever, never have any doubt whatsoever. You had to transition in a very binary way and be, if you're a trans woman, you'd have to only like feminine things. Like it was that kind of system. There was also really problematic theories that were being written at this time that being trans was due to either a sexual fetish or because of not wanting to be gay. And so, or it's sort of like related to sexual orientation. So we had to rule those things out, that's not the reason somebody wanted to transition or have gender affirming medical care. And then I think one of the most problematic things that would happen at this time is that there was a requirement that you had to have the ability to quote unquote pass as their desired gender. Yet you had to pass as being cisgender without getting any gender affirming care. And determining whether or not you pass was the clinician's role. So this is just a really fucked up system, pardon my language, but it's so horrific and traumatizing. And it also put people in very dangerous situations because another requirement was that you had to live for 1 year as your desired gender before you could go on hormones, before you could have any gender affirming surgeries, which would be really, really dangerous and put a lot of people in danger to be able to have to dress in that certain way without having that medical care that they needed. And then finally, people of color in these gender identity clinics were just explicitly discriminated against, excluded from getting care. Also, transmasculine people were completely excluded. So it was only white trans women who were really wealthy who could even go through this, but going through that is super traumatic. So this gatekeeping history is a community trauma in our history. And a lot of people don't conceptualize it as this community trauma that you might think of like HIV as a community trauma. But so this is something that's really, really important to keep in mind when we're working with clients. Because if we think about this history, how is this going to impact our trans non-binary clients today, right? And so, of course, it's going to create a lack of trust. Our field has been stigmatizing, it has harmed, it has gatekept of what cisgender people think it means to be trans. We have to prove ourselves, we have to prove our identities. So of course, this is going to create a lack of trust with mental health clinicians. So this is something to keep in mind, that it's actually completely normal, justifiable if a client comes in and doesn't trust you right away. Trust has to be earned, and it's on us as clinicians to create that affirming environment, acknowledge our power and the systems that we're in to build our trust with our clients. And similarly, understanding that this is a historical trauma, or potentially current trauma, because there's still harmful gatekeeping practices that happen to this day. So thinking about, as clinicians, having that trauma-informed approach within healthcare settings is also, I think, an important lens to have. So thinking about, again, how does this knowledge impact our clinical work? Well, first, all of this, what have we learned in our psychology training, right? What have we learned about our roles as gatekeeper or gender affirming medical care? Have we internalized some of these beliefs that, like, oh, we should be evaluating whether or not somebody is quote unquote truly trans, right? Or if their gender has been consistent since childhood, those kinds of things. So we need to be self-reflective, and we also need to be really sensitive and attentive to the power that we hold. As clinicians, we have the power to diagnose somebody with gender dysphoria or other identities, right? So that's a lot of power. We also have gatekeeping power because we're in a system where a lot of folks will require letters of support to get gender affirming surgeries. In California, we're moving to a informed consent model for hormones, but for surgeries, we definitely often still have to write those letters of support. And so then another reason that I want to talk about history and context is because trauma gets passed down, right? So I want to talk a little bit about intergenerational trauma and intergenerational resilience. So what we know from research is that historical traumas, community traumas, can impact later generations who were never directly impacted by the trauma. We know that this trauma can be passed down biologically and environmentally. And so this is important to keep in mind, that clients might be holding and still healing from trauma that maybe they didn't personally exist, but their ancestors, their community members experienced. And on the flip side, I think this is something that's super important and super helpful for clients to understand, is that the trauma, the resilience and the strength of what our ancestors had to go through, what our transcestors had to go through, any of our communities that we hold, and we can draw on their strengths. We can think about how they overcame so many awful systems of oppressions or traumas, and that is also passed down to us. Right? If we think about ourselves in a greater timeline than just us, we think about our history and we think about the future and we think about the collective, right? That my resilience, my strength, my healing from this trauma that might go back centuries is also going to impact the future generations and their resilience, right? And that, I think, thinking about us in a larger system in the history and collective, this is huge. And I think it's been really meaningful for me and my personal healing. And I think it's something that we can bring and talk about with our clients. Okay, so we got about 30 minutes left. And so I'm going to kind of go through a lot of content here. I'm happy to follow up if anybody had clarifying questions. But a lot of my research focuses on minority stress and resilience. So I wanted to talk about these concepts and then apply them to trans and non-binary people of color. So I'm not sure how many people are familiar with this model. I know it's like an academic model, but I do think models and theoretical frameworks can help our clinical work, and future research. So the minority stress model is one of the most prominent models within trans and non-binary research. The main idea with the gender minority stress model is that there's two different types of stress factors. So these are stressors that are above and beyond our day-to-day stressors, and they're stressors related to our marginalized identities. Distal stress factors are really those external stress factors that come on to us, like discrimination, rejection, victimization, and then related to trans identities, non-affirmation of our gender. Because of these external stressors, that's how we develop internal stressors like internalized transphobia, concealment, etc. And I'm going to go over all of these. But then also in this model, very importantly, is resilience factors. So what can mitigate or buffer the negative impact of the stressors that we experience? And all of these things will help impact our, sorry, looking at the chat for a second, impact the mental health experiences. Okay. So I'm just going to use some of my research that I've conducted. I conducted a qualitative research project on minority stress experiences of non-binary people. Specifically, we had a 60% POC sample. And so just want to talk about some of the unique ways that trans non-binary people of color might experience discrimination. So discrimination, right? We kind of know what these are. There's definitely a lot of medical discrimination that trans people experience, public accommodations, that's huge. But then also thinking like intersectionality. So like in terms of employment discrimination, some participants talked about getting reprimanded for professionalism due to their gender expression, right? And we also know that professionalism also is a very white standard. And so if you think about that intersection, that might also come into play with employment discrimination, for example. In our study, lots of people of color, also trans feminine people, were targeted by police and security. And so you can see that intersection of those stereotypes coming into play. So one major area that is super stressful for trans and non-binary people that doesn't get a lot of attention compared to like bathrooms and things are TSA. I have so much stress going through TSA because when you go through the scanner, a person looks at you, they don't look at any documentation, and they just look at you and decide whether you look like a man or a woman. And then they literally pick a pink box or a blue box, and they press that button and you go through the scanner. But let's say, they pick the blue button, but you're maybe a trans masculine person or something, but you're wearing a binder, then they note that that's not what's supposed to be there. And then that can lead to a very aggressive pat downs. And so if you look at this example from Skylar, this is what they're talking about, that they press a button based on what they believe your natal sex is. And so for me, at least regularly, they get that wrong and feel the need to pat me down aggressively, which is fun, obviously in a sarcastic manner. Also, of course, in airports, there's lots of racialized targeting as well. So just wanted to give a few examples there. Okay, so rejection is a big one. I think rejection, family rejection, this is one of the most prominent stressors that sometimes is unique to LGBTQ community. So when other people end or distance relationships based on one's marginalized identity. This can be particularly tricky for trans and non-binary people of color because they might experience rejection based on their gender and based on their race, which can be difficult. Also, for people of color experiencing rejection from their family or from their racial ethnic community could have even a potentially worse impact, right? Because oftentimes maybe family is a source of support, a very big protective factor in terms of racism, or maybe you have very strong values and ties to your culture or to your family. And so having that rejection might have an even greater impact, which is tricky, right? So, and then similarly, a lot of people of color feel uncomfortable or feel rejected within or unwelcomed, excluded in LGBTQ communities or trans communities, because often these spaces are dominated by white people. And there's also this notion that this is like a white community. All right, so if you don't belong there, but then you don't feel like your gender or sexual orientation belongs within communities of color or within your family, then you really can be put in this double bind, right? So if kind of looking down here, a lot of people feel like they have to prioritize either, one identity or the other and compartmentalize, but they can't fully integrate and be their full selves, right? Like, okay, I can go to Pride, but I have to kind of downplay my race, or I can go to this other event that, or see my family, my extended family, but I really have to conceal or play down my gender or sexual orientation, right? So then that can create this conflict between these two different identities. Also, I just want to mention that so within collectivist cultures, nonconformity might be seen as disrespectful or going against cultural traditions. So in communities where, harmony and the collective is much more prioritized, then it can be more difficult to have that authenticity or figure out how to affirm your gender, because it's not just about yourself, it's about it, you're kind of a representative of your whole family or community. So that can be another challenge. I think something that I was thinking about is Kimberly Crenshaw's work. And so some of the things that she's looked at is domestic violence. And one thing that she really talked about is how, Black women will experience domestic violence or abuse from Black men, but they might find it really difficult to speak out about that, that abuse that they're experiencing, because they don't want Black men to fulfill a stereotype, a negative stereotype, right? They don't want to make their own community, Black community, look bad. But then, how do they heal from that? How do they confront that? And so I think I've seen a parallel process here, whereas maybe, people of color might experience rejection from their own family or community members, but it's hard to share that because they don't want to fulfill a stereotype that, like, oh, all Latinx people or whatever it is are like homophobic and transphobic, right? But we would never, if a white person kind of said, like shared, hey, my family didn't accept me, we wouldn't say, wow, all white people are transphobic, right? And so there's this added pressure of wanting to not make your own community look bad, but then that can put you in a tricky situation, right? How do you get that support when you are experiencing rejection from within your own racial community? Okay, time is flying by. Okay, so harassment and violence, I mean, this is a huge stressor, but definitely is much more prominent amongst trans feminine people, amongst people of color, and specifically Black and brown trans women or trans feminine people. We see the murder rates going up and up. They're always horrific. If you've ever gone to Trans Day of Remembrance, it's really terrifying. And again, if you look at the influence of misogyny, of racism, this is why we're seeing such high rates of Black trans women being murdered or being assaulted. And so I think this is really an issue that's important to understand, that the safety risks are greater for people of color, right, for trans feminine people. Okay, one unique finding that came out of my research around non-binary minority stress was just the constant invalidation. And I think this happens across the board for a lot of trans and non-binary people. But basically, somebody will share with somebody like, hey, I'm non-binary, or use they them pronouns. And then other people are just like, no, you're not. Like people will just generally say that to you and feel like they know your gender more than you know yourself. Oh no, you must just be a tomboy. You must just be gay, or like you're just confused. You're figuring it out. Oh, you're friends with so and so. So maybe this is just like a phase or a trend. All the time, like chronic invalidation. And so this, I just feel like is so harmful. And then thinking about that intersectional perspective, a lot of our participants of color talked about getting invalidation, or people saying like, no, you can't be non-binary because that's for white people. Some participants were like, yeah, everybody says like, that's white people shit, right? That's not for us. And so I'll just read this quote because I think it kind of sums it up. So Jaden says, there's pushback sometimes from inside the Puerto Rican community that it's a thing for white people. So when I first came out to a couple of my family members, they said, that's a millennial white, that's for millennial white people. Like, what are you doing? That's not for us. That's not part of our community. Another research participant who was an international student from China, their parents were like, oh, you're just doing this because you're being peer pressured or you're influenced by like the white people, right? And so just as another example that this was a major theme among the people of color in our study. Okay, I'm just going through so many different hard experiences. I know I'm going through quickly, but we are going to get to the resilience section. Okay, so I want to talk about misgendering. This is just such a common experience and constant experience. And so I think the cumulative nature, the additive nature of this, or constantly having to correct people or figuring out whether or not to correct people, all of that brings a ton of stress. Sometimes other people might have difficulty with pronouns, especially using they, them pronouns. So they will project their own discomfort with not being good at something or feeling like they're messing up, and they'll project that negative energy onto trans and non-binary people. So then that can be very stressful, particularly for those who use they, them pronouns. This can create like a hyper visibility, like, okay, if I want people to know that I'm non-binary, because we live in a world with binary normativity where everybody's assumed to be in the binary, I am always having to come out. I'm always having to specify like, no, that doesn't fit for me. And that creates like a lot of hyper visibility. And I don't always want that attention, right? But then for other people, other trans and non-binary people who use he, him pronouns or she, her pronouns, there's a lot of cis normative assumptions. So people might just assume they're cisgender based on their pronouns. And so pronouns are not the same thing as our gender, but a lot of people will perceive us based on the pronouns. And so then that can create a lot of stress. And then finally, misgendering is not just with pronouns in our name, but it also is just gendered language that maybe doesn't feel like it fits with us. And so I definitely know that a unique challenge is for people who use languages that are highly gendered. It can be really hard to figure out how to navigate that. And then also sometimes creating new language that's gender neutral can be a slow process and might not be well received by others. So that can be another stressor. Okay, I want to talk about burdening. This was another huge finding from our study, and I think it occurs particularly a lot to trans and non-binary BIPOC folks. So what burdening is when other people expect this mental and emotional labor of non-binary or of trans people, of saying like, I've never heard of, like in a therapy context, oh, I've never heard what non-binary is. Like, can you explain that to me? Or like, oh, I'm just really curious how this works. And then that person's having to expend that energy to educate people. Not only educate, a lot of times people have to prove or defend their identity, right? If somebody's like, oh, really? Well, you don't look non-binary or you don't look androgynous, right? People have to say like, no, I am, or these are the reasons why, and really educate other people. So that's a lot of labor, which is really stressful. There can also be a lot of tokenization of kind of just feeling like people are being used as their identity, but without actually valuing them as people. And then finally, another way that burdening happens is expecting other trans and non-binary people to make you feel better when you make a mistake. So we're calling this cis fragility because I do feel like it really mirrors white fragility, which is just like, you know, not being able to handle the shame that comes up if we recognize that we've done something that's harmful to another person. And what happens is, you know, a lot of over apologizing or just making excuses. And then it's like, oh no, it's okay. Like it happens to, you know, it happens. And then there's a lot of caretaking that that person has to do who maybe felt invalidated or harmed by the microaggression or misgendering. So I'd like to just share a few quotes because I feel like this really kind of brings the point home on burdening. So I love this quote by Bird. So they felt this labor that's put onto them. They said the emotional labor of having to be the trans encyclopedia and being perfectly calm and respectful because you can't be one of those quote angry trans who quote freak out when you get their programs or pronouns wrong. So feeling that pressure to always be educating. And Jay talks about, this is from like a work meeting. So when somebody misgenders them, they feel really bad when they realize that they've used the wrong pronoun and they've used like sir, and then it kind of derails meetings, and I have to like massage their feelings and make them feel okay. And I'm not interested in kind of being their therapist in that moment. Okay. So, okay, really thinking about intersectionality now. Within all communities, there's still a hierarchy of who is at the top, right? Who has the most privileged identities and who doesn't. So there becomes these normative narratives, right? Of who is trans enough, or what does it mean to be trans? And these are really have racialized messages, right? So within trans communities, those who are closest to, have closest proximity to white manhood and white womanhood, those strict gender roles, that's going to be what's rewarded. And those who are further from that, that's what's going to get punished. And so I think it's really important to talk about this narrative because it really impacts us as trans and non-binary people. And it's also very much internalized by others. So I'm going to show a graphic. I just want to put a little trigger warning that it can be stressful to look at because it kind of goes through what this narrative that is really, really painful and a lot of trans people struggle with. Trans and non-binary people. So in a different training that I did, which I've cited on some of my slides, so just wanted to shout out to my colleague, Sergio Dominguez, who also helped me with these concepts. So we developed this box. This is a trans enough box. It's like, this is what it means to be trans enough or an ideal trans person. And it means that, you know, this comes with being white, being thin, able-bodied and minded, really fitting that hyper masculine, hyper feminine. You have to pass cis-normative ideals of what your body should look like. And then also that you have to have a binary medical transition. You have to always have known that you're trans and you're out about it, and you have to have experienced a lot of gender dysphoria. And so those who fit within this narrative, you know, they're still stigmatized, but they get some of this protection. Whereas if you're outside of this, then there's a lot of judgments about, you know, whether you're trans enough, you might feel like an imposter, right? And all these other invalidation and other discriminatory experiences. So kind of summarizing the trans enough box. Really, there's within the trans community, there is a white transnormative dominant narrative of like, this is what we see in media, this is what we see in like documentaries, right, of what it means to be trans. And what it means is that this narrative also has directly come from that gatekeeping system that we talked about. Because people had to fit themselves into like, I have so much gender dysphoria, I hate my body, I only want to be feminine, or I only want to be masculine. I guess in most cases, it was, I only want to be feminine. And that was the only way that cis people could understand the trans experience. But that is not, I mean, maybe for some people, they might align with that, but for many, many other trans people, that is not their experience. But we internalize like, this is what it means. And if we don't fit that, then maybe we're not trans enough, or maybe like our identity is invalid. And that leads to a lot of internalized questionings and struggles, right? Like we are not allowed to have any doubt about our gender whatsoever, when most of the trans people I know continue to have doubt or continue to go through different transitions. Like gender is fluid, it's not always static. And so it can have a really negative impact when this is internalized. Clinicians also internalize this, right? Because of this history, it's really passed down. These messages are really passed down in our field. And so when clinicians are doing assessments for letters, oftentimes they're actually looking for these things. You know, when did you know you were trans, and did you always feel that way? There's a connotation that, oh, if you're really trans, you must have always known since you were a young child, right? And that or assumptions that like you must, oh, you're on hormones, you must want top surgery next, right? Those kinds of things. So I think that's something just wanted to bring to light, which goes along with the concept of internalized stigma. So now we're getting to the proximal stressors in the minority stress model. And so this is the internalization of all those different things that we talked about earlier. I think for sake of time, because I want to get to the resilience section, I'm actually going to go pretty quickly through these. So anticipated minority stress. There's a lot of hypervigilance, self-monitoring, a lot of anxiety, just waiting for the shoe to drop, waiting for somebody to misgender you, waiting to be rejected. Like this quote from Alex, like I haven't dated because I'm terrified people won't accept me for who I am. And so that anxiety definitely creates a lot of extra stress. When thinking about concealment and disclosure, this can be also very tricky to navigate. One thing that's really important is that concealment is not always harmful. It can be helpful, it can be protective, and sometimes it can be harmful when we really want to not conceal and be out, but we feel like we can't. That's when it becomes harmful. But if we feel like, you know what, my grandparents don't need to know that I'm non-binary, and that's okay with me. I still feel like I can be my authentic self in most situations, or I can still have the same look that I have with my grandparents. I'm okay with not fully disclosing, right? And so it's really up to that person and what feels okay with them and their level of concealment. That's what matters. A lot of the research and the narratives about coming out has been from a white perspective, saying coming out is good, we need more people to be out and loud about their identities. But what the research shows is that verbally disclosing has positive impacts for white people, LGBTQ people, but it has no difference if disclosure or not for people of color. And so just understanding that the risks of disclosing verbally might be higher among BIPOC communities or people who are from a more collectivistic culture. So it's very common, I think, for a lot of people of color that I know who won't disclose to extended family members or something like that, but there's still maybe a subtle acknowledgement of what they're experiencing through their gender. So nonverbal forms of disclosure might be much more common among BIPOC folks. Okay. Oh, time just went by so fast. So what does this all come down to? All of these external stressors, which create internal stressors, leads to higher negative mental health outcomes risks for two-spirit, trans and non-binary BIPOC people. But what we also know is that BIPOC and trans and non-binary people might have more resilience and more protective factors because they've been dealing with oppression around their race. And so it's not always that it's just like all the marginalization is going to completely lead to way worse outcomes, because resilience also comes in. I will be sending this article, so I'm not going to kind of explain the whole model, but basically this model that I published expands the minority stress model and identifies different resilience factors, whether it's a group or community level resilience factors or individual resilience factors. And so I'll just go over a few. I'm happy to answer questions in the second part about this as well. But as clinicians, I think it's super important to connect people with positive role models. This could be, in person, it could be online, and it could definitely be social media. It's really hard to find somebody, like in this quote, this participant was like, I never have seen a non-binary person who's not white, and I'm South Indian. So once I saw somebody and met somebody with that same intersection, it was so powerful for them. Creating a sense of pride and active resistance can be really, really helpful. And also thinking about that history. This example from Alex talks about embracing my identity feels like rejecting majority culture and getting back to the roots before colonialism, right? And so that can create a lot of pride about resisting systems of oppression. Gender euphoria is a term that I love, and really we've always thought about trans people and gender dysphoria and the distress you feel, but also it's really important to think about what makes us feel good, what makes us feel affirmed in our gender, whether that's clothing, whether it's people that we're around, whether it's different language that we hear ourselves being referred to. And so as a clinician, oftentimes what I do with clients is think about how can we create a gender affirmation plan. So I know that many of you have probably created like a coping plan or a safety plan. You can really do a similar thing, but think about who are the people that you feel affirmed with? Who are the people that see and understand your gender? Is there a certain piece of clothing that makes you feel really good and in your embodied gender? And so if you're going to have experiences of invalidation, and that might bring up gender dysphoria, how can you combat that with having a plan of getting that gender affirmation afterwards? I think I discussed this. I can't emphasize enough how important it is to reconnect to our histories and how powerful that can be. So I'm happy to talk about that more later. Okay, great. So 2 minutes left, and this is, I think, my last slide. So finally, I just want to talk about, I think something that's really important is to recognize our strengths and our resilience. We experience a lot of stressors, right, on the day-to-day. But we in our research asked people, what do you like about being non-binary? What strengths do you feel like you've gained from this? And people had a lot to say. And in my own therapy experience, thinking about the strength that I've gained, and how that can actually translate across different aspects of my life from my identity has been really helpful. So people feel like they can be free from gender roles. I think one common thing is, okay, I've learned to stand up for myself and my boundaries. And because I'm standing up for myself and my gender, and now I'm able to do that in other areas of my life. I'm able to have more confidence in myself and not care what other people think. And also being able to understand other people's experience and have more compassion for others. So having that strength-based approach, I think, is really important as well. Whew. Okay, so a lot of talking from me, and I think we're ready to move on to comments from the panelists.
Thank you so much for this amazing presentation. And please, Kiona.
So again, my name is Kiona Dalen. I use they and she pronouns, and I live on the ancestral land of the Kumeyaay people, currently known as San Diego in the dominant culture here. So I took a bunch of notes. I really loved your presentation, so thank you so much for sharing that. So I'm just going to be like adding little bits to it, and I'm going to try to not talk forever because I love talking about all of this also. So I feel like I could go on and on, but I will try to make sure that we have plenty of time for questions and for Matthew to chime in as well. So I wanted to kind of, some of this I'm just going to be echoing because I feel like they're really important points to carry with you as you go out into the world as clinicians, and also just as people who are trying to do better by trans and non-binary people of color. I think the going back to the beginning when talking about gatekeeping, and there is a lot of gatekeeping that has come from the world of healthcare, and I just want to I am not a clinician. So I'm going to be kind of bringing some things out of the clinical world to kind of give perspective from the end of the people who are sitting on your couches, right? And so gatekeeping in the world of healthcare echoes out into the culture, right? I know from my personal experience, the first time I attempted to come out as non-binary, I was told I was not trans enough. And I immediately stepped back and said, oh, okay, I'm so sorry. I don't mean to step on any toes. I don't want to be taking up space, right? And I stuffed it for like another decade before I really came out again. After doing a whole lot of soul searching, but it really shut me down. And that came from other trans people who are also non-binary, but present in a different way than I do. And, but it all comes from that same place, right? It all comes from the same history of what is trans enough, right? And how that has played out over the centuries through colonialization, but especially through healthcare and all of these markers that trans people have had to meet to be affirmed, right? And to be like allowed to live as ourselves in public. Within that, and this came up in a couple different points, but this is a piece that I find personally relevant, but also I find relevant to a lot of trans youth, which is the majority, like in a professional setting, that is the community that I've worked with the most around in terms of direct care and direct service is with trans youth. And it is so much more fluid than it was in previous generations. Not just in having more people identifying as non-binary, but that even within a more binary identity, the ideas of what it means to be a woman, what it means to be a man, are very, very different than in previous generations. And so there is, I guess I just want to bring it as a point to be aware of that you might find as clinicians working with trans people of different age groups, you might find that the way they talk about this or conceptualize it within themselves and within their community is very different across generations. It has changed rapidly, and it doesn't, it's not a universal experience of what it means to be trans. And some of that is people having the direct experience of having experienced the gatekeeping and gone through these, extraordinarily long questionnaires before they're allowed to have access to gender affirming care versus younger kids who might have more access, especially here in California. So yeah, I just wanted to kind of bring that to the front. And then with thinking about that and thinking about looking at the different stress factors and looking specifically at the rejection piece, it's very alive in cultures. It's very alive within our families and in our communities. It also is very alive in trying to find a therapist. That is a personal thing for me that I'm still going through at this point, is that I can't find somebody who is Black and trans and queer and not Christian and right, like my list is quite long, and works with people who are neurodivergent, which I am, and I have to choose every time. I have to choose, okay, what's the most important piece of my identity that's related to what I'm struggling the most with right now. And let me pick somebody who's going to hopefully help me with that piece, because thus far it has been literally impossible for me to find somebody who truly understands my full set of intersectional identity. And so for you as clinicians, as therapists, I hope that coming away from this conference today, that you not only feel like you have learned something, but that you seek out more ways to fill in the gaps for yourself, so that you can serve people who have these intersections, who struggle to find affirming care, but also just like competent care that can take all of these factors into consideration when talking through mental health stuff. As we while we talk about this is also there is a piece about invalidation, and again I want to put that into this context of invalidation happens in therapy a lot, and sometimes it's just by asking questions, doing the burdening thing, right? Where it's like, oh man, I have to explain this to them, but also this person has a PhD, this person has is supposed to know more about the way minds work than I do. That there can be, just by the basic power dynamic that exists walking into a therapist's office, that those questions have a lot of power, and to try to get your answers not from your clients. I have had to explain so many things to various therapists over the years, and oftentimes that is the session where I say, okay, this person does not have the tools and understanding to help me. I'm going to have to find somebody else. So being mindful of that, and maybe even if it's just making a note for yourself to look something up and find some resources before you meet with that person again, and then coming back to it rather than putting them on the spot in their therapy session to explain their identity to you and how it works. If something is confusing or new to you, that it's not only burdensome, but it is invalidating to have a therapist kind of question how we get to be who we are. So yeah, I'm just blowing through these, so I hope this is going okay for everyone else. I feel like I'm talking a lot. Sorry, I'm just reading my notes here, which are kind of scattered because listening and writing at the same time is sometimes hard. So with misgendering, this is such a huge, issue, even though it seems like such a simple thing, right? But it happens so frequently, especially for those of us who use they, them pronouns. I actually, with a recent therapist that I chose not to work with, I just decided to say that I only use they, them pronouns, which is not generally how I operate. But I just wanted to see if she could keep up with that. Because I figured if she can't even do that, we're not going to be able to go into the depths of what's happening with me and my own inner journey with gender and everything. And she couldn't do it. She was using she all over the place and was talking to me about my inner little girl and all this stuff. And I was just oh, okay, well, this is not going to work. I encourage you, if you struggle with using they, them pronouns, to practice on animals and babies, because they don't know the difference. If you meet a random baby, instead of being oh, boy or girl, just start using they, them. And then if the parents think it's weird and want to specify something, then that's fine. But it is a gender neutral way to talk about people. It's not just specifically for non-binary people. And so that's a great way to practice. You could also practice on animals, right? Like, oh, is it a boy or a girl? It's a dog, who cares? The dog doesn't care. Unless you're breeding it, it doesn't matter. So that's a great way to practice without stepping on feelings. And if you have somebody in your life, a client or otherwise, whose pronouns have changed since you've met them, this is where a lot of cis folks really struggle with misgendering. I encourage you to like spend some time thinking about what part of you associates them with the pronouns they used to use. Because if you misgender an animal or a baby and somebody goes, oh, no, it's a girl. You're like, oh, I'm so sorry. And it's like, for some part of your brain just automatically makes that happen. And it's like, and you'll never misgender that kid again, right? But somehow with adults have a really hard time, or with kids who are old enough that you've been calling them one thing for a while and now you have to call them something else. So sitting with yourself and thinking about what part of you has decided that the way they present themselves is only clicking with one specific idea in your mind of what gender they should be, can also be just really illuminating for yourself to look at how your brain is determining gender. So I invite you to do that if misgendering is something that you struggle with. I also wanted to speak, and this is very much from my perspective as a Black person, on the difference between cis fragility and white fragility, because they are similar, but I find that there's, I have very different experiences with people with one and the other. And the main difference being that when people think you're calling them a racist, they think that you're telling them they're a bad person. Whereas transphobia hasn't quite gotten the, I don't know, societal support, I suppose, at this point for people to really feel like you're automatically telling them they're a bad person because they don't understand trans people. Which, you know, we could go into a whole moral conversation about what that says about people, but the gut reaction that I get from a white person when I've told them that something they've said or done is racist or is coming from a place of white privilege is a very different reaction than I get when I talk to somebody about gender. Most of the time, I get confusion around gender stuff and wanting a lot of explanations, which is like not ideal either. But it tends to be less violent, for lack of a better word. And so, yeah, I just wanted to name that because there are similarities, but I feel like there's a very strong difference in like the vibe that people give off when doing either of those things. And then, so the last two things I wanted to say is just, and this is not really part of the presentation stuff, this is just my own kind of spiel that I always want to tell to people when I'm on a panel like this. Something that you can do that I think you should do, that every person should do, that I try to do as well, is to learn about cultures that you're not a part of by engaging with it through media, so that you don't put the pressure on the individuals in your life, clients, friends, family, to teach you, right? That you can learn a whole lot by just following people on Twitter or subscribing to, if you're a magazine type of person, so, you know, subscribe to some magazines that are about and made by and for cultures that you're not a part of, and identities that you're not a part of. I have learned so much about about so many identities that I am not a part of by subscribing to media, and it has completely changed the way that I even talk about my own identities and talk in spaces like this. So because as it was said earlier, the people who have the proximity to privilege, right, are always boosted to the top. And so if you're only paying attention to the stuff that like busts through the glass ceilings or whatever and makes it into mainstream media, makes it to the news, then you're only getting this like tiny, tiny piece, right? And that tiny piece is probably coming from the most privileged people within that group. So choosing to engage with books, with podcasts, with although, you know, podcast world has its own hierarchy of people who actually get heard, but especially social media, right? Social media is this amazing tool that we have where you can access a huge variety of perspectives. So I encourage you to do that and to be critical as you encounter these things about who are you seeing. If you're going to if you're looking for trans folks to follow, are you only finding white trans folks? Are you only finding trans folks who fit within a binary or are cis-passing, right? Which is, you know, its own problem. So being critical of what you're missing, looking for what you're missing, and then finding it out in the world and not demanding it of the people closest to you will help you in general, but especially with serving your clients and having some idea of like what are the conversations that are going on right now that are in front of the people that you're serving. Oftentimes I go to a therapist or a healthcare provider and like clearly like you're not getting the same news I'm getting. We're living in two different worlds and you have no idea what mine is, but I know what the dominant culture's world is because that's unavoidable, right? So I just encourage you to seek out other sources. And with that, I will quiet for now and pass the mic, and feel free if you have any questions to put them in the Q&A. Thanks.
Hello, my name is Matthew Meritori. My pronouns are he, him, and I wanted to jump on really quick and just say thank you so much for your presentation. It was beautifully laid out. I geek out a little bit on PowerPoints, so I very much enjoyed this. I also took some notes as well. Yeah, so during your presentation, there were multiple times that I was just like, oh yeah, yep, you know, oh, I can relate to this so much. And just because it is, it's a part of so many people's story. I work as an office manager for a practice, and part of my job is to help train our clinicians of how to better serve our transgender non-binary community. And when it's my job, I enjoy it. When I'm in my personal therapy, I do not enjoy it. You know, it's not my job. I want to come into therapy and make this a safe place. But however, it's not necessarily my job to make it a safe place as well. It just needs to be a safe place. I remember when I'm still currently trying to get everything ready for one of my surgeries, for top surgery. And I had a therapist who I explained everything, including on how to write the letter. And that was a lot of fun. And she decided she was not capable of writing such letter. So of course, that was our last session. But I've unfortunately have had some experiences with clinicians that have been far from affirming and more of me educating them. And also I've had wonderful therapists at the same time. I have found a handful of therapists who actually know what they're doing, who don't ask me to educate them. And that's mind-blowing, to be honest. It's something that I'm in school to be a therapist, and the reason for that is because I would like to be one of the therapists that our community can come to. Being able to understand and being able to do my own research. I'm not going to sit here and say I know everything. I am learning just as much every single day. I remember when I came out as transgender, my foster parents, they decided to tell me that it was just a phase, and it was because I wasn't able to click with our community, back home in Tennessee. And I was just trying to figure out a way to be different. And, don't worry, you'll be back to cisgender, give it 3 years. It's almost 4 years. And thankfully, I do not have those thoughts in my head. And, something that I also wanted to talk about is that I do not consider myself as this masculine transgender man. You will catch me on the street skipping because it's something I enjoy. And I've had a few altercations due to that, due to not looking like or presenting as this masculine man. And it took me a long time to be okay with that, to be okay with not checking that box. And I also had to learn the difference between my gender and my sexuality, because that was a huge thing for me. I wanted to make sure when I transitioned that I was straight, because maybe that'll be okay for my family, for their culture, and then, but really, I learned in the process, and even now, that it doesn't matter. I am who I am as a human being, and I will love whoever I love. And that took years to figure out. And so now I'm very happy to say that I still love to skip and I still love to be me. And, in this process of, with all the surgeries and the gatekeeping, it has been a challenge. But also, I do also understand the trauma that we hear from other people in our community being passed down to us because of that fear. It took me a long time to even go see a doctor for hormone replacement therapy and for any type of treatment, because I didn't want to have a war story, to be honest. I didn't want to. I heard so many stories, and I just didn't want to be a part of that. I already struggled with the internal things, so why would I want someone else who is in the medical profession to just confirm my insecurities? However, I have been very lucky with being able to find the right people and being able to, there's something that I learned early on in my transition was to educate myself. I couldn't just walk into the doctor and accept what they have to say. I would challenge them with, this is what the research says. This is, even legally, this is not right. And the thing is that we shouldn't have to do that. However, it's been something that has been, that's worked for me. Once again, I want to say thank you so much for your presentation. I learned so much in it as well. And I think that's it on my end. Let's see here.
Awesome. Thank you so much, Matthew and Kiona and Dr. Matsuno. This has been wonderful. The panelists have been like, do we ask them to move on? And we were like, but this is really good. So anyway, a little longer than we had planned as a host of this event, but it's just so many thanks.